Hello, everyone. Thanks so much for joining me today. My name is Lydia, and this is Time with Lydia, the pharmacist. Today, I'm going to be spending some time with you talking about a very common condition that most of us would have suffered from at some point in our lives, and this is the common cold. We normally would call it a cold. We are going to be looking at the symptoms of a common cold, and we're going to be looking at some ways of preventing a common cold. Our highlights will be ways of getting rid of a common cold. This is a channel where we educate ourselves on common health problems. So if you're new to this channel, please don't hesitate to hit on the subscribe button and also on the notification bell so you don't miss any video that I upload. And to all our returning subscribers, I just want to say a big thank you for all the support. So a common cold or a cold is a mild viral infection of the upper respiratory tract, that is the nose, the throat, the sinuses, and upper airways. It's very common, but there is no cure for a common cold. It usually clears up on its own within a week or two. A healthy adult should expect to have 2 to 3 colds per year. In infants and children, this can be more. Cold symptoms come on gradually, normally within 1 to 3 days of exposure to the virus, and symptoms can vary from person to person. Symptoms include a blocked or runny nose, a sore throat, mild headache, muscle aches, coughs, sneezing, a raised temperature, pressure in your ears and face, loss of taste and smell, which is also a symptom typical of coronavirus infection. So if you have a loss of taste and smell, don't immediately think it is a coronavirus infection. It could be a common cold. The only way you can tell is to get a test carried out. The symptoms of a cold are the same in adults and children, but sometimes symptoms last longer in children. It is always difficult to tell the difference between a cold and a flu, so the following are some clues you can use. Cold and flu symptoms are similar, but flu tends to be more severe. Colds appear gradually, whilst a flu appears quickly within a few hours. A cold affects mainly your nose and throat, but a flu affects more than just your nose and throat. A cold will make you feel unwell, but you're able to carry on with your normal day-to-day activities, example, going to work, whilst a flu makes you feel exhausted and too unwell to carry on with your normal day-to-day activities. You should often treat a cold without seeing a doctor. In fact, you should begin to feel better in about 1 to 2 weeks. But if this does not happen, then visit your doctor. If your symptoms do not improve after 3 weeks, if your symptoms get suddenly worse and your temperature is very high or you feel hot and shivery, if it is a child and you're concerned about their symptoms, if you're feeling short of breath or you develop chest pains, if you have a long-term medical condition, for example, diabetes, or a heart, a lung, or a kidney condition, or you have a weakened immune system, for example, because you're having chemotherapy. These are some of the reasons why you should visit a doctor or a healthcare practitioner as soon as you can. So let's look at the causes of a common cold. Many types of viruses can cause a cold, but rhinoviruses are the common cause of a common cold. Because many different types of viruses can cause a common cold, you can have several colds, one after the other, as each one may be caused by a different virus. In general, a person becomes contagious from a few days before their symptoms begin until all of their symptoms have gone. This means that most people will be infectious for around 2 weeks. A cold virus enters your body through your mouth, your eyes, or nose. The virus can spread through droplets in the air when someone who is sick coughs, sneezes, or talks. It also spreads by hand-to-hand contact with someone who has a cold or by sharing contaminated objects, such as eating utensils, towels, toys, or telephones. If you touch your eyes, your nose, or mouth after such contact, you are likely to catch a cold. There are some factors that can increase your chances of getting a cold, and these include age. Infants and young children are at greatest risk of colds, especially if they spend time in childcare settings. Also, people with a weakened immune system. Having a chronic illness or otherwise a weakened immune system increases your risk. The time of year is also another factor. You can get a cold at any time of the year, but both children and adults are more likely to get colds in autumn or fall and during winter. Smoking is also another risk factor. You're more likely to catch a cold and to have more severe colds if you smoke. Being a passive smoker can also increase your risk. Exposure is also another risk factor. And if you're around crowds, such as at school or on an airplane, you are likely to be exposed to viruses that cause colds. So what can you do to prevent a cold? A person with a cold can start spreading it from a few days before their symptoms begin until the symptoms have finished. There is no vaccine for the common cold, but you can take some precautions to slow the spread of cold viruses, as well as to prevent yourself from catching a cold virus. Number 1, wash your hands. Wash your hands thoroughly and often with soap and water for at least 20 seconds each time. If soap and water are not available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Teach your children the importance of hand washing. Avoid touching your eyes, your nose, or mouth with unwashed hands. Number 2, sneeze into tissues. Throw away used tissues right away, then wash your hands thoroughly. If you don't have a tissue, sneeze or cough into the bend of your elbow, then wash your hands. Number 3, don't share. Don't share drinking glasses or eating utensils with other family members. Use your own glass or disposable cups when you or someone else are sick. You can label the cup or glass with the name of the person using it. Do the same at work. And number 4, stay away from people with colds. Avoid close contact with anyone who has a cold. Stay out of crowds when possible. Avoid touching your eyes, your nose, and mouth. Number 5, take care of yourself. Make sure you're eating well, getting some exercise, and having enough sleep, as this is good for your overall health. Control stress. People facing emotional stress regularly have a weakened immune system, which implies that they could catch a cold easily. So reduce stress and live a healthy life. And number 6, cleanliness is very important. Keep household surfaces like doorknobs, drawer pulls, keyboards, light switches, telephones, remote controls, countertops, and sinks clean. These are the places where viruses lie for hours after they are used by an infected person. Number 7, avoid smoking. Cigarette smoke could raise the chances of catching a cold and other infections. And as much as possible, avoid passive smoking as well. Now, how can you get rid of the common cold? There is no cure for the common cold. Most cases of the common cold get better without treatment, usually within a week to 10 days. Sometimes it may linger for a few more days. The best thing you can do is take care of yourself whilst your body heals. For example, drink plenty of fluids, humidify the air, use saline nasal rinses, and get adequate rest. Antibiotics are of no use against the common cold virus, and they are only recommended to be used when there is a bacterial infection. You can also get relief from your symptoms by using over-the-counter medication from your local pharmacy to reduce fever, body aches, nasal congestion, and cough. These remedies might help ease your symptoms and keep you from feeling miserable. They're generally safe for older children and adults to take, but might not be suitable for babies, young children, pregnant women, people with certain underlying health conditions, and people taking certain medications. Always read the patient information leaflets that comes with your medicine before taking it, and follow the recommended dosage instructions. If you're not sure which treatments are suitable for you or your child, speak to a pharmacist for advice. And remember not to take two medicines with the same active ingredient. For example, do not take paracetamol on its own as well as a cold remedy that contains paracetamol, because too much of a single ingredient could lead to an accidental overdose. Always speak to your pharmacist if you're not sure about what to take and how to take it. For fever, sore throat, and headache, you can purchase paracetamol or ibuprofen from your local pharmacy. Children can be given paracetamol and ibuprofen as well for fever and pain. But as I said earlier on, make sure you speak to your pharmacist for advice if you're not sure about anything. If you are experiencing nasal congestion, then you can use decongestant drops or sprays for up to 5 days. Avoid prolonged use of these as they can cause rebound symptoms. Children younger than 6 years old should not use decongestant drops or sprays. Vapor wraps can help babies and young children breathe more easily when they have a cold. Apply the wrap to the child's chest and back. Don't apply it to their nostrils because this could cause irritation and breathing difficulties. Nasal saline or salt water drops can help relieve a blocked nose in babies and young children. And also currently, there is some evidence to suggest that taking vitamin C supplement is beneficial when a cold starts. You can purchase vitamin C from your local pharmacy. Now, let's look at some lifestyle and home remedies that can help you get rid of a common cold and make you feel as comfortable as possible. You can try some of the following. Drink plenty of fluids, water, juice, clear soup, or warm lemon water are good choices. Avoid caffeine and alcohol, which can dehydrate you. Sip warm liquids, chicken soup, and other warm fluids, such as tea or warm apple juice, can be soothing and can loosen congestion. Honey may help coughs in adults and children who are older than 1 year. Try it in hot tea. Adjust your room temperature and humidity. Keep your room warm but not overheated. If the air is dry, a cool mist humidifier or vaporizer can moisten the air and help ease congestion and coughing. Clean your humidifier regularly according to the manufacturer's directions to prevent the growth of bacteria and molds. If you have a sore throat, gargle some warm salt water. Add a quarter to half teaspoon of table salt to a glass of warm water. Gargle the solution and then spit it out. Do not swallow the salt water. Children younger than 6 years are unlikely to be able to gargle properly, so do not make them gargle salt water. And finally, get some rest. If possible, stay home from school or work. If you have a fever or a bad cough or are drowsy after taking the cold medication, this will give you a chance to rest and heal, as well as reduce the chances of spreading the cold virus to others. I hope you have learned something today. Please give this video a thumbs up Share with family and friends. And remember to leave your comments in the comment section. If you haven't yet subscribed to this channel, please hit on the subscribe button and also on the notification bell so you would be amongst the first to see any video that I upload. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.